request our Honorable Vice Chancellor Dr. Satish Kumar Bhandari sir to welcome the resource persons and to deliver the welcome note.
Good afternoon. Hearty welcome to you all from Nitte University. I congratulate the Bioethics unit of our university and the Department of Education, UNESCO Chair Bioethics, HIPAA, for organizing this unique webinar on bioethics and COVID-19 pandemic. I heartily welcome the distinguished panelists, the messiah of bioethics, call him guru of bioethics in Indian continent, psychiatrist by profession and my very good friend, Professor Russell D'Souza, my another friend, Colonel Professor Derek D'Souza, Director, National Bioethics Curriculum Implementation Center, and also Professor of Prosthodontics from Maimer Medical College, Pune. Our very esteemed international speaker, Professor Gerard Furtwängler from University of Applied Science and Arts from Hanover in Germany, very multifaceted personality, scientist, epidemiologist, qualified in law and ethics, very distinguished panelist from international arena we have got with us. Moderator, good friend of mine, Professor Miri Matthew, head of Indian program from Manipal, Mahe, to this very distinguished panel, I welcome once again for this unique webinar. I recognize the presence of our secretary, Dr. Suraj Shetty, and Professor Sadhana Deshmukh, our director of Staff Development Center, Nitte University, and all the office bearers, coordinators of Nitte Bioethics Unit, and also office bearers of other wings of, particularly student wing of Indian Bioethics Unit. A warm welcome to all the participants to this prestigious event. As you all aware, in this it was the normal circumstance, we would have had the privilege of welcoming the bioethics family to Nitte campus for our ethos 2020, which was planned in our campus. Unfortunately, it has been postponed for the next year, and I apologize for that. As we all know, we are going through very unprecedented public health crisis due to COVID-19 pandemic. And in spite of most stringent lockdown measures by various countries, so far more than 19 people have succumbed to this pandemic, and 19 people have been affected, 19 million people have been affected, and more than 9 lakhs have died. This has caused a widespread health burden, as you know, throughout the world, and it has not even spared our healthcare workers and hundreds of frontline warriors. Doctors, nurses, and paramedics have succumbed to this very ill understood novel coronavirus. With the search for an effective drug and COVID vaccine underway, there is hope that we may be able to get this disease under control. However, the realization of the benefits of the vaccine, the public is at best several months away, and only option available now we have got is social distancing and personal protection. The pandemic, the subsequent lockdown measures to control the spread of the virus, various treatment options, healthcare costs, and the search for vaccine have revealed new ethical concerns. Nitte University has been committed for delivering good quality healthcare, imparting good education, and promoting ethical standards among its students and staff in the campus. Despite the challenges faced during the pandemic, we have tried to continue in our quest for maintaining ethical standards in healthcare and education. With all our education programs being delivered online, we organized a number of workshops, webinars on COVID education for staff, students, and even the public as well. 50% of the beds in the hospital has been dedicated to COVID-19 patients. The first COVID patient, a 10-month-old child in the district, was treated in our hospital. I am delighted that we have another relevant and very crucial webinar considering the ethical aspects of COVID-19 pandemic. We're the most apt and esteemed panelists to discuss the matters such as ethical issues in developing COVID-19 vaccine, what is the way forward with the pandemic, and how we should respond to this global health concern. The ethical issues in human trials and COVID vaccines are many. Any vaccine should provide significant benefits to the participants in the trial and the general public, and any such benefit should outweigh the potential harm. There may be potential adverse and harmful effects, particularly with the experimental vaccine, and even it could potentially increase the risk of viral infection. These and other ethical concerns will be discussed in more detail by the panelists in today's webinar. There is no doubt that the stress reduces immunity and also increases the chance of viral infection. With the increase of anxiety, depression, and stress levels, not only among the general population, but also among our healthcare workers, it is imperative that we should look at the ways to maintain our mental well-being and look for ways of developing positive mindset. Our able panelists will deliberate on all these issues, and I have no doubt that this deliberation, the learning derived from it, will help all of us, and it will help us in becoming more wiser to deal with the situation. Without much ado, I invite Mr. Mary Matthew to carry on the further deliberations. Thank you very much. Once again, I congratulate the team for organizing this very prestigious webinar on COVID pandemic and effect on mental health and other issues concerning the doctors and medical students and paramedical and other uh, professionals. Thank you very much.
Thank you, Professor Bandari. Thank you for the invitation, and good morning, good evening, and good afternoon to all our participants, and especially our international and national panelists for today. Before I start with this international webinar, a brief introduction to the UNESCO program in bioethics. This program, that is the International Network of the UNESCO Chair in Bioethics, HIFA, was first started as an agreement between the Director General of the UNESCO and the Rector of the University of Haifa in Israel in 2001. The current holder of this chair is Professor Amnon Kami. And the reason for establishing this chair, the mandate of this chair, was to stimulate and to train medical students in ethics in developed, underdeveloped, and developing countries through a modern curriculum, which is based on the 15 principles of the Universal Declaration of Bioethics and Human Rights. Currently, now we have 250 international units. In India, we have 74 units, of which I am the head of the Indian program, and we also have 60 student wing units of this chair. So to start this webinar, just a few rules. If you like, you can put your questions in the chat box and we will try to address it to the panelists. And we have speakers today, and I will introduce each speaker prior to their presentation. So our first speaker is Professor Dr. Russell D'Souza. Many of you know him, and he's now become synonymous with ethics, especially in India, and that is his passion. He's the head and chair of the Asia Pacific Division and the Director of Education of the International Network of the UNESCO Chair in Bioethics, Haifa. He is also the Dean of the International Institute of Organizational Psychological Medicine. Today, he will talk about a problem, or rather a solution to COVID-19, and what is happening with regard to human challenge studies for COVID-19 vaccine, the ethical issues. Professor Russell D'Souza.
Thank you, Mary, and thank you, my good friend Satish, Professor Satish Bandari, and Derek and Gerard Fortney from our team. I'm delighted to be here. As you know, I have Nitte is very close. I was actually before I was with the UNESCO, I was already involved with the rural program of the Nitte University. Came out here and they were doing some wonderful work in the rural area, in the area of mental health. So I have great and on to commend Dr. Dr. Sarisha, your Chancellor, Dr. Shri Vinay Hegde, a great man, and I have great respect. He's a good friend, and I'm delighted to be here on this day. Now, let me put this my presentation up. I go to screen, then you go there. Okay. Am I? Oh. Okay, can you see my screen?
Yes, Dr.
Yes,
Rossi.
we can. Yes, we can, sir.
Yeah, and you can hear me too. That's good. Okay,
Yes, yes.
I'm going to quickly talk about an important area on human challenge studies. As you know, why did I pick this? The current situation, as as our Vice Chancellor noted, the world is going through an unprecedented time, and we are left at the moment. I'm talking to you from Melbourne, Australia, and right now here, not very different from you, we are having the second wave, and we are in a stage 4 lockdown. And this is back to public health issue of 101, that is using the non-pharmaceutical methods of quarantine, social or physical distancing, and so forth. So the reason is because we don't have a treatment, a known treatment, an effective treatment, nor do we have a vaccine. But of course, this is a big race happening, and right now there are maybe around over 100 area of possible vaccine that are coming out. And as some places move to the phase 1 studies, we see now the next issues are kind of how to bring this quickly out to go through the fast tracking and so forth, because of the millions of people that, as we just heard, have been affected around the world. And in this process, various area issues have come, various methods and strategies have come up. And as we approach the phase 3, one of the areas that's come up is the human challenge studies. And this is, while it's well known, this has been brought up, and there's a major debate going on in terms of the ethical issues. And has been brought on further with the WHO in May 6th coming out with a statement. And so I'm going to present to you some of the issues that we face, and that the ethical issues, and how do we look at the ethical dilemma that we face. Now, so that's the gist of what we're going to do, what I'm going to present to you. Now, experts in infectious disease and public health have been warning that this pandemic is going to be with us for a long time unless we find a vaccine. And now this means how soon these researchers can achieve this goal is the question which everyone's asking. And of course, the answer to that depends on which strategies we are going to adopt, or the researchers around the world are going to adopt. Now, we know on an average, at the best estimates, that usually for a vaccine to come to market, it takes around 18 months or longer, indeed, most of the time, much longer. And one of the things that have come up in this moment is when Edward Jenner proved that giving cowpox to an 8-year-old boy protected him from the infection of the deadly smallpox virus. This approach has raised concerns. And today, such trials have careful designs and required to undergo extensive ethical reviews. Now, when we talk of the trials, as you know, the various candidates have been picked and have around the world. The race is on. Over 110 or so candidates are there, and some have already started human trials in phase 1 trials. So what actually happens is when we move on from phase 1 and 2, we come to the phase. We need to go through the phase 3, looking at efficacy. Okay, and here we talk of the human the human phase 3 coronavirus human challenge trials. This is also known as the controlled human infection models, and it's an essential tool for developing new vaccines. And there's now, because of this need or the urgent need, they identified a need to start preparing for the COVID-19 challenge trials, because we need to quickly manufacture an unadulterated version of the SARS-CoV-2, the virus that causes this disease, as they might not be available in time to develop a vaccine against it. But the phase 3 coronavirus trials, human challenge trials, uh, for this willing past participants would receive the vaccine candidate, and then once the vaccine takes effect, they'll be deliberately exposed to the live coronavirus. What does this do? This type of exposure to the virus is guaranteed in a human challenge trial, and it may be then possible to judge a candidate's efficacy much more quickly, and importantly with the far fewer participants than the conventional or the regular standard phase 3 trials. So what happens then is, if we can provide a more rapid signal of efficacy through this human challenge trials, this would enable earlier decisions about the vaccine candidate, which goes further to tell you that the company or wherever to start manufacturing, and at the scale for it to be rapidly dispersed to reach the the uh, uh, um, the population. So that is the urgency, and that's why this has now become an issue that has been discussed. Researchers give an experimental vaccine to healthy volunteers, then test or challenge the vaccine by purposefully infecting those volunteers with a strain of the disease to test the efficacy. But in a conventional vaccine trial, researchers administer either an experimental vaccine or a placebo, but they do this to tens of thousands of volunteers and then wait for nature to do its work, and this process can take many years. But all, given what's happening, our urgency with the loss of lives, the large number of cases, the viral growth, and importantly, the economic effects beyond even the effects of loss of life and so forth, have made an urgent calling people, and so there's a great need now. Researchers are all started working and thinking, and even the WHO has brought in and come into this area. And of course, what is resulted is a heated debate about the ethics of such research. And we, of course, here, even in an emergency and even in this situation, it is but important that we still examine and look at the ethical issues that we have to go through in albeit in the rushed focus due to the acute needs that have been demonstrated. Now, researchers who conduct human challenge studies always they argue against human challenges for a new coronavirus, and this is the issue that happens, and that's why the controversy and the debate has come up. Even immunologists at the National Institute of Allergy and Infectious Disease who stage human challenge studies for influenza and currently are in the work or in the field of human challenge studies note that with the COVID-19 is so new, it's not clear how often this virus makes people seriously or indeed leaves them with a long-term complication. And in the United States, we have the organization called One Day Sooner, an organization that's come up. They have now in 100 countries thousands of volunteers ready to start take on become human challenge to take on this human challenge trials. It's an organization that advocates on behalf of COVID-19 challenge trial volunteers. And the mission of this One Day Sooner, this organization, is to advocate on behalf of challenge volunteers, which is somewhat different than advocating for studies themselves. So they say that they want to help people participate in challenge studies that would accelerate a vaccine. Even the need we see in the effect of this pandemic, there's a need to accelerate, and this organization they set this up of volunteers, and they don't want volunteers to take unnecessary risks that aren't justified by a clear public benefit. So that's the type of things that are happening. Then we have the proponents to this human challenge studies. Public health imperative, it saves most lives. They involve fewer research participants than the standard research methods, and it also requires fewer volunteers. It's offer because of that, it is considerably cheaper to carry out, and importantly, they are not tethered to natural infection rates, so you can accelerate the progress in this phase three, pre pre um, uh, bringing out getting a pre-registration and so forth. And of course, it can determine how rapidly, more rapidly, the effectiveness of or the efficacy of this vaccine candidate. So that's the proponent. But on the other hand, we have the debate, people opposing, and from an ethical perspective, questions such as this strategy puts volunteers at higher risk than the conventional vaccine trials. And one of the leading principles in research ethics is minimizing risk to research participants. But when we expose the volunteers to SARS-CoV-2, we think it would be unethical since there is, importantly here, there is no accepted treatment for COVID-19, a rescue, a prerequisite accepted, but if only when treatment is available because we need a rescue treatment in these in these human challenge trials. Now, there is this human challenge trials have been used. The World WHO, the National Institute of Health have supported for long the human challenge studies in the past. And of course, as I said earlier, this has resulted in vaccines against such infected such areas as malaria, cholera, and typhoid. But a long-standing caveat that has always been there in the use of human challenge research method is the prerequisite that there exists an accepted treatment for the disease under study, which we say the rescue medication. But what we see here with the COVID, that requirement is currently not met, and hence many questions and issues are being asked, and that was what we wanted to look at here. Now, this is made even more relevant because, as not very long ago, on May 6th, the WHO issued a document called Three Key Criteria for Ethical Acceptability of COVID-19 Human Challenge Studies. Now, what the WHO did was they had a group of ethicists and so forth, and they came up with a conscientious among ethicists who have reflected upon human challenge studies that an international infection of research participants can be ethically acceptable. After having this discussion, they came up with a conscientious statement that we can intentionally infect research participants, and that is ethically acceptable. Of course, the WHO has a list of ethical criteria for acceptability of such studies, but in that criteria, what is noted, they have not mentioned the requirement that there must be an accepted treatment for the disease. This has been a long-standing caveat, but in this COVID-19 expediting the vaccine process or getting the vaccine candidate approved and bringing it to use, in the statement they seem to have left this important caveat, and that has raised a number of questions and issues. WHO has listed 8 criteria for the SARS-CoV-2 challenge studies. But importantly, the second criteria mentions that the potential benefits and risks should be compared with other feasible study designs, and of course, risk should be minimized. But when we talk of, however, comparing to those standard methods of studying preventive vaccine, the risks to subjects in these challenge studies would definitely appear to be considerably greater. As some or many participants in a standard vaccine study, not the challenge, but the conventional um, studies, they may never fall victim because to the disease because it's by natural, and so they may never fall a victim to the disease under study. So that's a couple of critics have into this area. Now, the WHO also lists risk minimizing strategies, selection of low-risk patients, young people, we know them who are the vulnerable, so young, no comorbidity, reducing the number of participants where feasible. And this is risk minimization strategies for the human challenge trials. And the third one is the initial challenges conducted one by one with careful titration of wider dose. Now, what we see is the first two strategies certainly reduce the overall risk to the group of enrolled participants taken as a whole, but only one criteria or the third criteria involves the risk to an individual who is injected with a pathogen that causes this serious illness and can be fatal. Now, this was on the 6th of May. On the 7th of May, the NGO AIDS Vaccine Advocacy Coalitions made a statement on ethics in COVID-19 in the area of human challenge studies. While the AVAC acknowledged that the WHO statement certainly articulated important criteria for assessing a human challenge study, the AVAC have noted that they've omitted the most important one. Until there is an approved treatment, a challenge trial with a potentially fatal, as yet untreatable, is unacceptable because of the lack of having a rescue, and it can be fatal. So we see how the debate, the controversy, the issues are there, and it's still important for us to consider all this. So we talk now of one is it ethical to inject and infect a volunteer to get the result, to benefit a greater number of people? That the ethical issues are there. The issues about the lack of or the inability of having a rescue medication because we do not have an accepted treatment. And another area that comes up in understanding or in enumerating some of the ethical issues, I just noted two or three of them. One other area that has come into question is about informed consent. Every such because we now have at least what's available. There is a lot of interest in people are interested in participating in challenge studies. In USA alone, over 25,000 people have already volunteered for these challenge studies. And of course, what it comes out is altruism is mentioned as the reason for these volunteers who have now listed and given their names and ready to take part. But what is being asked and noticed here, there is no way of knowing how well informed these individuals are really about the risks and benefits of participating, or even whether they are indeed really altruists, although that's the reason or that's the stated reason that they have been accepted as volunteers. And another important factor that can cloud or have an effect on informed consent is the fact that usual practice in medical research when we use phase one healthy human subjects is to pay them for their participation at times, and in fact, it also we pay them significantly. That's that's what we know. So there is questions being raised beyond what I already alluded to, the issue about informed consent. Now, there's another issue that has been brought up, and this is around social justice issues. From standard practice, it's virtually certain that monetary payment, which of course will be considerable, knowing that we have knowing the the need to bring this out quickly and the global need for this, we expect that the monetary payment would be considerable, and of course we have the risk that this will serve as an inducement to enroll. Now, what happens when we see there is a likely inducement? The likely result is that you might have a disproportionate number of volunteers who come from the lower income brackets, even more particularly in the current pandemic state, because many people have lost their jobs in this pandemic, and many are in moved down into this lower economic bracket. Now, what does this then reflect on, particularly in the Western world or even USA or probably globally? It is likely that many volunteers then would be from the lower socioeconomic members who have been put into that due to the pandemic, loss of job, loss of business, and so forth. And of course, in many of the countries, this also moves into racial and ethnic minorities, particularly in the Western world where I live, and in countries like the United States and so forth. And this then raises a serious question or serious questions about social justice. Now, these are the type of issues from the term in terms of the ethical points that have been raised. But it is our duty, even knowing that there is a need, there is an urgency. Fast tracking is taking place. Several checks and balances that in conventional time have been there and have stood the test of time are being dismantled because of this global need, the race that is taking place, and of course, in my own view, this is possible. At the end of it is also a financial. Whoever gets this will see the improving the recession that most countries are in at this moment as a result of this pandemic. Now, to add to all this, we have the Council for International Organization of Medical Sciences ethical guidelines for research. They have come out with an advice on human challenge study there, and they suggest that some risks cannot be justified, even when the research has great social and scientific value, as we see now. And adults who are capable of giving informed consent would give their voluntary informed consent to participate in the study. So they say that even when the need is so great, and even when the adults who have capacity to give informed consent voluntarily, it cannot be justified. And of course, they have cited studies for anthrax and Ebola. So what are we left with? We have this urgent need. Lives are at stake. Economies are at stake. The world is looking for this, and we have the WHO giving us saying that it's now ethically acceptable. We have others asking questions. So we are left ultimately in a quintessential essential ethical dilemma, which we have to look at and think. Is it permissible to intentionally inflict serious harm on a few for a possible benefit of many? Right? with several vaccines, as you all know, already down in the pipeline, coming through phase 1, and we are now approaching phase 3, and with the need for acceleration. The current state, we see disproportionate numbers of minorities and poor people are going to likely be the subjects or volunteers to enroll. And the last issue or the last dilemma or question that I put is a justifiable rush to begin a human challenge vaccine trial for a very grave reason, grave disease that lacks any effective treatment. Is, can we still say it is ethically justified? I put this to all of us, all of you. Um, this is the dilemma which we, after putting both sides, I'm leaving this open to you to think. And I'll end with Josh Morrison, the founder of Weightless Zero, talks. It may seem counterintuitive to think of urgency and caution in the same breath. Urgency and caution in the same breath. But even to those who oppose challenge trials, because without an identified rescue therapy, must admit, once such a therapy exists, it would be better if challenge testing was ready for use rather than lagging far behind, because anything less is reckless behavior that endangers people who will die without a vaccine in the future and indeed dishonors the sacrifice that challenge volunteers stand willing to take. So I rest this with all of you to consider and think and which what should be done. We have a need, a demonstrated need from illness, hardship, death, and economic hardship. And we have questions of ethics that we need to achieve these things. So, how do we balance this? So, I will end with that, with these questions, these dilemmas, putting this to you, and hope that we'll all in the next months. We are going to see this get as we move towards the phase 3. This is going to be brought up, and we will certainly be debating these ethical issues from time again. Thank you very much for your time and listening to me.
Thank you, Dr. Russell, very beautifully for elucidating the debate around the ethical aspects of taking part in the human challenge of COVID-19 vaccine. And you brought out the issues of consent, informed consent, the issues of autonomy, the issues of is it right, the utilitarian principle, greater good for greater numbers, and the question of monetary inducement in taking part in the challenge. And the problem around this vaccine is that we do not have a treatment. Like you said, other diseases such as malaria had a rescue therapy, whereas COVID-19, we do not know what exactly is the best treatment. And that is where the problem arises. And of course, the participants who are in this study would be probably the ones of low socioeconomic class because of the monetary payments or the inducement that is there. So these are issues that we have to debate on and think about it before these challenge studies go ahead. So there is a question from one of the medical students from Nitte. It says, recently the CEO of Bajaj Auto Industries, Ravi Bajaj, said that he won't be taking the vaccine and would resort to keeping social distancing and other methods to improve his immunity. amidst all this, how can we justify the unrest behind injecting the pathogen, however weak it is, into our body? So the issue is, if this vaccine becomes mandatory, uh, what about people who refuse to take the vaccine? And of course, you debated whether it is ethical to inject this vaccine. What are your thoughts on this, Dr. Russell?
Well, it's a very good question, because just this weekend in Melbourne, they arrested protesters who are not protesting, saying that we shouldn't be. They are not willing to take the vaccine. And today,
Right.
there is a call that the government should mandate that everyone must take the vaccine. So there's one group of saying that because it affects public health, one person's individual, it's going to affect everyone. So this is a debate here, because even before the COVID came, we have a big issue, and I don't know with
Anti-vaccine lobby is
yes,
there. We
yes,
know that there is
yes, and this is for such area, and we have got measles has come back. We in
measles.
Australia.
Yes.
Yes, and now the government this is now even nothing to do with COVID. We have brought in now that they can't go to a school, won't accept you, and still they have homeschooling because they still won't take the vaccine,
Yes.
and
Yeah.
they've
There's a
even
big lobby on
yes,
vaccination,
yes.
anti-vaccines. Yes.
But on
So
the other side, I think we got to think about the issues that I'm bringing up here is that we are in a situation that, like everything else, the structures that are normally there have been pulled down because of this rapid need to bring this here. So it is just important that we still reflect on those ethical issues. And I've raised this. In the end, the WHO has already said that it's ethical, even though there isn't the rescue medication, and the lead and the potential of fatality is also there for the
yes,
and we have thousands of people ready who have already registered. That
yes,
is another.
but that itself is an ethical issue, because are
Yes,
they taking part for, like you said, for altruistic
that's
purpose,
what,
or is it because of the monetary inducement? That
but
is also there.
yeah, from this they've registered, and they got to give their reason why they're doing it, and they've all written altruism. They want to save the world. They consider themselves soldiers, like joining the army or something like that. But whatever it is, I think this is a time, because we are in right now started phase one, and
Yes,
very shortly we will have to. They will a candidate will come up that will have to go through the three, and they want to accelerate that part. And so, of course, the WHO has given after a conscientious statement saying it's ethical, and there's others questioning it, even organizations and so forth. So I
yes.
guess that's the,
Yeah, so we have quite a few vaccines that are coming out, and apparently by this weekend we'll have Russia putting out their vaccine. We do not know much about how this vaccine was, what all phases of trial it has gone through, and whether it is done ethically. So there are many issues when it comes to vaccine, and the question of who's participating and the reason for participating. Thank you
but,
very much.
but the
Yes.
phase three is important because it's the pre-registration phase, and it's that phase that we have to be able to demonstrate efficacy. In phase two,
Yes.
you'll have safety, but phase three
Yes.
has to demonstrate, and it's there that they see you can bring it quicker, you can bring it cheaper, smaller, and so that's the reason this is coming. But we have to think of the ethical issues too. And
Yes.
I wanted to bring that up. This is an important forum. The Nitte Bioethics Center of the UNESCO chair. And so this is very valid that we give them food for thought. All our students all have to think about this, because they will be
Yes.
talking
Yes.
about
Actually, this question has come from a medical student in Nitte and Shema, actually. So it's really good that people are thinking, students are thinking about this. Thank you very much, Dr. Russell. Professor Pandari, would you like to say anything regarding vaccines or the COVID challenge? You're muted, sir. You'll have to unmute yourself.
unmute,
Yeah. Uh,
unmute yourself,
Yeah.
Congratulations, Russell, for wonderful presentation on vaccine. I think the next speaker, there's a
We'll
time
go ahead with,
running out
yes,
of
all
time.
right, okay. Yeah, thank you very much. So our next speaker is Professor Gerard Fortwinkle. He's a person who wears many hats. And without further ado, he's from the University of Hanover in Germany. And today he will be talking to us about responding to COVID-19, what is required. Professor Gerard, the stage is yours. You may unmute yourself. I request all the other panelists to mute themselves so that we can reduce the background noise. Professor Gerard, you'll have to unmute yourself. You're still muted. You have to go to the lower bar. You'll have to go to the lower bar and you can see your microphone and you can unmute yourself.
Okay.
Thank you very much.
Thank you very much. Just give me 1 minute to go through the process again to get my presentation on the screen.
All right. Present now. You'll have to go to present now. Yes.
Oh yeah. It takes always a while, so just a second.
Yes, that's right. And you can put it on full slideshow once we can see it. Full show. Yes. Slideshow. Yes, very good. There. Thank you.
You see it now?
Yes, completely. You can see it very well. Thank you. Please go ahead.
Super. Yeah, do you see me? Can you see me or can you?
We can see you, sir.
Yeah, we can see you, Jared.
Okay, responding to COVID, yeah. COVID-19 has keeping us all busy, regardless of where we live, and for several months now. And even more, we don't know exactly how the situation will continue in the future and how the virus will behave in the coming weeks and months. So we just heard about the challenge study and what are the issues around challenging the virus after a vaccine has been given to patients or to volunteers. And the issue is that so far we do already know a lot, and we do also know what type of measures have been helpful in the past, but we are not, how should I say that? We are not sure enough about the virus, so that it is so much new things that come every day. And but what we can say all is that we are all infected, and not everyone in the same way and with the same intensity, but no one can close their eyes and say, okay, it is not my concern, this pandemic. It's nothing that has to do with me. So, and the pandemic is not only a health threat, it's an enormous has enormous economic consequences, and also affects our security and in several ways also human rights per se. So what we need, or when we can only face this pandemic together worldwide with our passion and with great solidarity. And we all did follow up on what did happen during the last months. And in today's presentation, what I want to do is I would like to summarize briefly what has happened so far worldwide in response to the crisis, and what needs to be considered, and which ethical aspects must not be forgotten. This is a short and concise overview, and not all related aspects are included in the analysis. However, I hope that the presentation gives an overview about the current situation, and maybe later on it can also be used as a good start for discussion. So analyzing the various global responses to COVID-19, it is easy to identify measures that have worked best, but will no doubt occupy scientists from years to come, because we do still learn every day something new. And but there are already few strategies that already seem to be coming out on top. And on those strategies, I want to concentrate on now during the coming minutes. The first one is physical distancing. And one of the main strategies used worldwide, and either through advising people to keep a distance of 1 to 2 meters from people they don't share a home with, or the cancellation of large events, the closure of shops and restaurants, and asking everyone to stay at home. So there is an increasing evidence that these measures do work and have saved thousands of lives so far. And it is critical, though they are used in conjunction with hygiene and also with sanitation measures. However, some other people might argue that lockdowns, like closing the shops and the restaurants and shut down the business, are not the solution in themselves, but a means of buying time so that other measures can be scaled up. And what we should not forget, and this is what we currently face here in Europe, is that the vast majority of people remain at risk after contracting the virus when the social and economic restrictions start to ease. So we are currently here in Germany and Middle Europe facing the problem that after a long period of time where people were very well following all the instructions, now those instructions have been eased, and they were making the shops were open again, the restaurants were opened again, and now we have again more than 1,000 new cases per day in Germany. And this was something that did never happen from early May until now, but now we are facing the problem that we had at the beginning of the pandemic. What are the ethical aspects when we talk about physical distancing? And from an ethical perspective, quarantine is a liberty-limiting measure. It is concerned with human rights and directly linked to social distancing, at least in certain ways. And this is also something that is very much criticized in Germany, that there are several groups now who say, okay, this is something that we don't follow anymore because this is too much affecting my human right to move, and it's too much affecting my human rights to meet other people. However, when it is, as I said, it might also be directly linked to social distancing. And for me, physical and social distancing is something different, because social distancing is in some ways more directed to certain groups of people, and for them it would mean an extra burden. It might also include additional harm for them. Okay, the next measure is contact tracing, digital contact tracing. And contact tracing is a targeted approach to finding cases of COVID-19 in communities and by tracing people who have come into contact with infected people. It's a good thing from the beginning. It's an approach that has been at the heart of outbreak responses for decades. We all learned about that when smallpox were eradicated in the 70s. In the past few years, it has been used in Congo, for example, in response to Ebola, where contacts were tracked down and vaccinated with a new Ebola vaccine. The countries that are faring the best against COVID-19 now include many invested in contact tracing from the start with the aim of containing the outbreaks. Yeah. However, so most of this digital contact tracing goes via smartphones, and smartphones are used to alert people who could have been exposed to the coronavirus, but there seems to be no substitute for a strong contact tracing network, because I think it is always good, in addition to this kind of digital contact tracing, to have also a local network where people via interviews can identify people who might have been in risk through interviewing people who have been infected and who did meet with other people, and then the health care workers can follow up on those who do meet with the infected people. From an ethical point of view, it is definitely important to clarify upfront a lot of ethical issues. And those ethical issues, they are linked to privacy and autonomy, and last but not least, they are also linked to equity. And that means, okay, for what purpose those information will be collected, for how long it will be saved, who's going to get access to those information. So in Germany, when you go, for example, when you go to a restaurant now, you have to leave your address and your phone number, and you need to list all the people who were sitting next to you at the table if you go for dinner or for lunch to a restaurant. And it is not really clear, because our government, although the government did react fast and did prepare a lot of guidelines and instructions, we still miss clear guidance on how this kind of information should be handled and should be managed. Nobody knows exactly for how long it will be saved and for how long it will be accessible to certain groups who have not been really identified. And then sometimes it is unclear, or it becomes even, how should I say, more difficult if people might realize that that kind of information has been forwarded to certain institutions without letting people know upfront. Very critical if you have people in the community who are against all this kind of measures and who do have a vote and who do protest and who do all these things to say, okay, whatever is going to happen now in this country is not really that should happen, because it's a kind of virtual panic, but it does not really exist. For those people, it is really what we say in Germany, it's oil in the fire, because they exactly are looking for something like this, that they can really have more arguments for their own discussion points. Equity is definitely also something that is very much important, because not everybody has a smartphone. And in Germany, we do have a little more than 80 million people in the population. And currently, we do have around 30 million registered people who did download this app to trace people for the coronavirus. Okay. Testing is a strategy such as contact tracing relies, from my perspective, on a robust testing capacity. So South Korea, for example, began open public testing as early as the beginning of February, even for people who were not showing any symptoms. And in Germany, we followed their lead from as early as end of March. Laboratories in Germany had the collective capacity to carry out more than 160,000 tests per week. Using a widespread testing, these countries were not only able to gain a more accurate picture of the extent of transmission of the virus in their communities, but more reliably identify those who could have been exposed and ensure that they have went into isolation. So it is really something that, if we want to get control over it, we can't do it without massive testing approaches. What are the ethical aspects? The ethical aspects when we talk about testings are, for example, has everybody access to testing, to test procedures? What about prioritization of certain groups? How to protect those who are at most risk, for example, the healthcare workers? What are the consequences for individuals? So is it really clear if somebody is going to be tested and is tested negatively? Is there anything that he has to consider? When has he or she has to show up again to do a retesting and so on? Although I talk about Germany now, although we do have a lot of policies and guidelines already implemented on very, very different aspects that are somehow related and associated with the coronavirus and with COVID-19, we have still areas where those kind of policies and guidelines are lacking, and okay, the governmental people work on that. And as I said at the beginning, not all the issues are clear and transparent for now, but people do what they can to build a framework of policies and guidelines so that people know, okay, if something is going to happen, what could be the consequences and where it is properly described, so that I know what the process is that I, as an individual, have to follow. Hospital surge capacity, this is also something that is very important. The implementation of lockdown measures have been based in many countries on concerns that the healthcare system is not able to cope with rapidly rising numbers of cases. Yeah. And some countries, they learned already from the SARS outbreak in 2003. And other countries did start now to get prepared by expanding isolation institutions, expanding the beds for potential patients who need to be ventilated, and also to expand the capacity of ventilators. No? This is fine, but what needs to be considered is, even if all those kind of technical equipment is available, it's only helpful if personnel is available that can operate this equipment and take care of the COVID-19 patients. You might have heard about this big hospital that has been built especially for COVID-19 patients in London, but was dismantled later on because of a lack of personnel resources to operate it. And some countries did definitely act in a way that they did expand their own resources, but in some areas they simply forgot also to expand the personal resources to make sure that whatever they did technically implement could properly be used. Then it's also a very interesting and very important question, the allocation of resources. The problem of dealing with shortages in resources has been discussed so often and will not be discussed here again. However, I cannot simply overlook it and not mention it. It is important to say that if clear guidelines are not yet in place, they need to be implemented. In addition to these guidelines, methods need also to be implemented to support those involved in the decision making during the situation when it will be decided, and especially afterwards, because it is not easy from hospital, for healthcare workers or for clinicians or physicians who needs to take the decision. This one goes to that patient and the other patient don't get anything. So this is not easy. And even if it, with guidelines that might be clear enough to help in this decision making, it's still a problem later on, or it could still lead to problems and harm for people who at the end of the day have to decide and then later on need to cope with this kind of emotional burden that they might take from this. So the next part is the personal protective equipment. Also a long story about that, so many times discussed everywhere in the world. Gloves, masks, and gowns, important for the safety of health workers around the world. And what has been done now, we did increase the manufacturing of such equipment by almost 40%. But what we learned from it, especially in countries here in Middle Europe, is that we properly prepared for that. So it took very, very long to get this equipment on board and to make sure that everybody who is directly working with potentially infected people, that those workers are properly protected. It took very, very long, especially also here in Germany. So now it's fine because the manufacturing has been increased, but at the beginning it was really a drama, and hopefully we did learn from that. And what is also important, as I said before, some did more concentrate on the scaling up of beds and ventilators, and some other countries, very few, did also properly pay attention to this kind of PPE equipment. Now we know that this could have been done much, much, much better at the beginning, but hopefully we will learn from this kind of experiences in that way, that when it comes to the preparation of any kind of emergency in the future, that this kind of PPE material is always available in that way, that this kind of emergency can properly be handled. From my perspective, the most important part is here also to, from an ethical perspective, to just imagine what people who are affected might ask and might also want to have answered and replied on by the governmental people. So what is my ethical duty to care for patients during the pandemic? If I don't have the material to protect myself, should I still go and help those and support the system? What about if I'm in a high-risk group due to age or medical history? Should I still continue, and should I take the risk? What is really my role? What is my responsibility? And we, as a society, we do have the responsibility to care for all who are affected during their work. And this is something where, at least here in Germany, we have to say we could have done much better at the beginning. Then clear messaging, give instructions, and communicate to the public. So that is, from my perspective, a basic requirement to get accepted, and to expect, if you expect compliance by the public, so it's fair enough to inform the public properly. And the style of communication is very different around the globe. And I think it should be a kind of unite against COVID-19. So from my perspective, it is not, it should be simple. It should be easy to understand. Simple protection methods like hygiene, mask wearing, distance keeping. This is something that what we learned in different populations, this is something that did help, and people did know, okay, this is something that it is expected that I should do as an individual. What, from an ethical perspective, is definitely not helpful is using images of war or messages about fighting against the virus. So, but even though analogies can sound compelling, terms like war and fighting may also promote panic, fear, and insecurity. So we shouldn't use that. And it's still in some talks or some articles, we still find this kind of wording. And from my perspective, we should avoid that, because this is not really helpful. And for the public, for the people in the population who do not understand that much about the virus, this could also be something that is definitely not helpful. Act fast, yeah. So act fast means, in a WHO COVID-19 briefing, Dr. Michael Ryan said that the greatest error is not to move. And what we have learned is that countries that implemented control strategies rapidly seem to be faring the best. So strong political leadership is required with a clear strategy, and this should be there, if not from the start, then at least only a little after that. So we shouldn't wait too long. It is definitely crucial that rapid response is based on evidence, as the urge to act without enough data and analysis can lead to misinformed health policy, and we should definitely avoid that. For many countries facing an outbreak like COVID-19 this outbreak has been an entirely new challenge, and the evidence around the effectiveness of control measures has been scarce. Capitalizing on the vast amounts of data becoming increasingly available now on what works best will be important for informing the ongoing response to COVID-19 and in preparation for any future pandemic. Yeah. We all have to learn from those responses. Our experiences and the amount of data that are captured now will definitely help us to understand the situation much better. Yeah. But even if it sounds so simple and partly like a phrase, it is, from my perspective, dangerous if someone says more detailed or someone gives more details on how we should behave in the future. From my perspective, we do not know enough. We learn more every day, and our actions must always be seen in the context of the temporal events. So we don't need people who talk about something that might be more speculative. We need science and we need political leadership that always makes decisions in the interest of all on the basis of evidence-based data. And my hope is that, as I said before, it must be a global approach. And it's fair enough to say, okay, currently we do have a certain level of knowledge. And with this certain level of knowledge, we do our best to implement measures, so to our best knowledge, for the population, to protect the population. But it's also good to repeat this so that we are still in the process of learning. We are still in the process that we cannot really confirm something that we do have now evidence for. So, and what I realize in Europe and in some countries around Germany is that more and more there are people who start now complaining because it takes too long, and the school should start again, and this is going to happen and that is going to happen. People start being less satisfied. And I think from my perspective and from an ethical perspective, this might have to do with the situation that it has too often said that this and this is going to happen. If I hear now that, for example, in December we will have a vaccine available, yeah, then it would be good if it would come like this. But nobody knows exactly what is going to come in several months down the road from now. So, and I think what is more important from my perspective is that whenever we talk to the public, or whenever the politicians talk to the public, they can easily include in their statements some kind of uncertainty to say, okay, for now, this is the best what we can do, and we hope that we get more information during the upcoming weeks. If I might say one word to the challenge study, it was a wonderful presentation by Dr. Russell, and all what was said is correct. However, as long as we do not know why the virus works in some of us so seriously, and people do really suffer hardly from that, and others just have slight symptoms or even do not recognize that they have been infected, and we do not know why we have this kind of different levels of reaction when we are infected. So it is really, or we should be very, very careful when we do really work with this kind of challenging strategies. Okay, thank you very much for listening to me. I will close the presentation now that I can also see you again, because I didn't see you now during the presentation. In the case of any questions, I'm happy to answer those.
Thank you, Professor Gerard. I think you have covered a lot of issue, practically every issue that we can think of. You started, and I'm very happy you used the words physical and social distancing, because they mean two things and they mean different for different people. That is very important. And you brought up this issue of ethical issues of contact tracing and the use of apps, which has also been a problem in India regarding privacy. Who all have access to data regarding your whether you're COVID-19 positive or not. So that is a very important aspect. And you brought up the issue of hospitals and their preparedness and the lack of PPE and testings, which developing countries and underdeveloped countries are still struggling. And the issue of communication, it's very important that all of us, or especially the people who are in administration and in the political level, speak the same language. And using those metaphors of war, and which you correctly said, is not it also instills a sense of fear, because here we've been saying we are all COVID warriors, and those kind of phrases is what we're using. So I think it is not necessary. We are all warriors in many ways. We are. It's not only doctors. It's not healthcare professionals. All of us are. We are all facing this pandemic together. So that is very important. And what you said is, every decision should be based on sound, evidence-based data. That is very important. And if political leadership does not convey the data properly, then we really don't know where we are in each part of the country and in parts of the globe. So that is very important. And it should be a global approach. And that is where the UNESCO platform is here as solidarity. And we talk together and we discuss around the world and what is best for all. And the question of equality, the question of equity becomes very important, especially in terms of vaccine. So you practically covered everything. And here they use a mnemonic called SMS, which is sanitizing, mask, and social distancing. So those are the measures that people are expected to take care of or rather use. So thank you, Professor Gerard, for really a beautiful presentation of many, many issues in such a short time. I was just wondering, there's a question that has been put forward. Would you be able to answer questions on herd immunity?
Sorry, please, can you repeat the question?
The herd immunity. Herd immunity. Herd immunity.
Yeah. What type of question is that? What should I say about herd immunity?
They want to know whether there is something called herd immunity, and if you get the disease once, will you have the immunity? Is it possible that they can get it the second time?
That would be perfect if somebody could answer that question. So for now, it would be nice if we know that if somebody has been infected and he is fine and he did recover, that he is safe for the rest of his life or her life.
Okay.
But we did hear already from some individuals who might have been reinfected. Yeah, we don't really know if testing was fine or if the tests were false positive, false negative, or something like this. But nevertheless, so far, there is no one able to say, okay, reinfection is not possible. Yeah. Okay. And if reinfection is possible, then we will never get a herd immunization. Yeah. So for now, this is what I say. There is too much speculation. Yeah.
Okay.
And if you really go in small steps, baby steps, from one step to the other, and always make sure that whatever I did is based on evidence data,
Yes.
whatever I do will be based on evidence data. So you can always go back and restart. Yeah. But you cannot go that way that you say, okay, as at the beginning in the UK, that the Johnson wanted to said, okay, let's go for herd immunization, and then we are fine. Yeah. And you know what the
What happened?
consequence was. Yeah, what happened. So it's what I don't like personally. I don't like is that there are too many different interpretations, too
Okay.
many different scenarios. Yeah. And we should only rely on scenarios that where we do have some kind of evidence that this is something that we can easily confirm with data. Yeah, and all the rest we can forget. In Germany, for example, we do have studies saying that small children lower than 10 years, they are not able to infect others.
Yes.
Yeah. But nowadays, we do have a school in the former eastern part in Germany, and the school has to be closed again because some people in the 3 or 4 year at school, they were infected, and there were so many cases now. Yeah, so it's contradictory to what we expected before. Yeah,
Yes.
and it is so much difficult as long as we do not have a clear direction.
Yes.
And as I would be happy if we know that if somebody is going to be vaccinated, he or she is safe. Yeah.
Yes. That's true. That's
But
true, because
but if not,
this is the same question that people are raising regarding opening schools in India. Should we really open schools? And because the thinking is that children don't really infect elders, and they don't get much of the disease. But I think once a school opens, we'll actually see the real effects of this virus on children.
yeah,
So
there are so many different study results
yes,
out. Also
yes,
in Germany, we have totally different results, and it's what should you rely on? So
yes,
people who are in favor of school closure, of course, they will refer to the studies who say, okay, you better stay at home, and the others say, oh, let's see, so we can
yes,
easily open it. There is no risk involved. Yeah,
yes,
and but it means that it is. We really have to wait, and we have to be very, very careful, and we always need to, how should I say that? We always need to take the most safest way. Yeah.
root out. Yes,
And then let's see. And if it was wrong and we realize a couple of weeks later we could have opened much earlier, okay, my God. Then
yeah, because
yeah.
I think
But
I
the
think
other way
Dr.
around is more dangerous.
Yes, Dr. Russell, because the schools were opened in Australia.
Yeah, but you see, that's what I was just going to say. You know what, that's changed now. Schools are open, schools are closed.
Yeah.
We got groups. One side it's closed, one side it's open, and but the thing that children can't, that has now changed. There is evidence they can
Yeah.
infect and so forth. So that was the start. And as I can see, over this time, we have learned everything is changing every day, right? And now we talk about when we started the program, the pandemic in Australia, there was a totally they were not confirmed that masks were useful. They didn't appreciate there was an aerosol transmission,
Transmission.
a surface transmission. So we were all into this surface, but now it is mandatory, complete change that you wear the mask and the type of mask, and a $200 fine if you don't wear the mask.
Yeah, it's true.
But the
Yeah.
same, this thing has
Yes, because
there are
evidence is whatever we are getting every day. It's changing. The evidence is
yeah,
changing. Thank you very much. Thank you, Professor Gerard, for a beautiful presentation of all the ethical issues, and Dr.
thank you,
Russell.
Gerard.
Uh, And we will go to our final panelist for today, a very good friend of mine, Colonel Dr. Derek D'Souza. He's the Director of National Bioethics Curriculum Implementation Center and the Head of Training at MIMA Medical College, Talegaon in Pune. He's also the Chair of PT National Training Course in UNESCO program of the Indian program, and he's my colleague in the UNESCO team here in India. And we are ending in a final a positive note, and he wants to tell us about COVID-19 and staying positive. Dr. Derek.
Colonel Derek.
Colonel Derek, Colonel Dr. Derek. You'll have to unmute yourself. Please unmute yourself. You'll have to, you're not able to unmute yourself? Is Suraj there?
No, I wasn't getting those
icons. You just have to put your cursor in the lower.
I got it now.
You can start your screen share. Go to present now. And press on your entire screen. Yes, thank you very much. Put it on full slide. Thank you.
Is that visible?
Yes, yes.
Yeah. Thank you, Dr. Mary, for that very kind introduction. And yes, it's wonderful to be here as part of the team. Thank you, Professor Satish Bhandari, for giving me this wonderful stage to talk to all of you. And of course, we had two outstanding presentations from two outstanding views, one from Australia and one from Germany. And they've set stage for a very, very, what shall I say, realistic view, wonderful panoramic view on this entire issue that is troubling the whole world. And literally, we can't think of anything else. Any topic that you pick up, any discussion, it somehow comes back to COVID-19. And this small little viron has really transformed literally everything that we can think of today. And yet, even though I say that, I feel there are a lot of positives that can be taken out of the current situation. And it's not all dismal, it's not all as bad as sometimes it seems to be. So with that little introduction, let's go ahead and see what exactly I need to talk about. This coronavirus, which has been around for some time, it's not something new. And unfortunately, this new variant, which was given the name of COVID-19, somehow, as Professor Fortwinkle told us, we are unable to understand why it behaves in the way it behaves. If it was predictable, it would have been so much easier. Treatment protocols would have been different. But somehow this little virus tends to play a very disappearing game. It tends to come up in different forms, and we don't really have a clear picture even as of now. And this is the dread that each and every one of us has, to see that COVID positive. Because this is the state all over the world, even though these figures are changing by the minute, changing by the hour. And of course, we've seen worldwide how much panic has been there, how much damage has been there, and even to the healthcare workers who have been at the forefront of battling this disease. And therefore, this is one of the most feared words that could be there now. And the minute we hear that someone is positive or there are new positive cases, it brings about a sense of gloom. So, if that being possible, then why should Derek here be talking about staying positive? And yet, I think that is what is very, very important for all of us today, at whichever stage we are in, at whichever position we are in. It's important to stay positive if we are to win the battle. If we are to, sorry, Professor Fortwinkle, we keep talking about it as a battle, but it is. We have to face it in any other words. So, what are the positives that we can take out from this pandemic, that we can take out from the situation as it were today. So I'm going to look at this under these various headings of healthcare, families and society, education and training, the environment, the economy, and of course, the political fallout. So we'll just list out the various areas and then we'll quickly look at and see what is the change on ground. The biggest change that we realized, and very, very quickly, was that this disease or this COVID-19 pandemic took us back to the basics. We realized that we need to maximize the use of technology, to have physical distancing between the healthcare workers themselves, between the healthcare workers and people who were not yet positive or who have not yet got the disease. So we need to develop ways and means by which we can continue to serve the population, and this is where technology can come in. It's very important to understand the cause and effect relationship and evaluate the benefit and harm, because we've seen various studies come from different parts of the world with sometimes a very small sample size, and yet we've taken that just looking at the final conclusion and saying, okay, can I apply it in my scenario? Because it was almost an emergency, because people were not really sure about the enormity of the cases that would be hitting them in the days to come. And what we realized was not to blindly follow or just rely on published data. And today, every country has realized the importance and the need to back self reliance and self sufficiency. Because with air travel being severely restricted, it was difficult to even get back people who were abroad. It was even difficult to move medicines, to move supplies, to move healthcare personnel from one part of the globe or maybe within each country, to move them from one place to the other. And yet, if we see that just since December 2019, the pathogenicity of the virus has been identified and verified, where we were not really sure what we were up against. Today, we at least have some semblance of clarity. To a great extent, certain randomized trials for treatment have been completed. Again, still a gray area exists, but there are some good points, and that has also resulted in a large number of patients recovering from the disease, and that is a good sign as well. Today, we have artificial intelligence that can distinguish COVID 19 very quickly from other pulmonary infections using radiographic studies, and that's a important part, or it can be an important marker, especially in trying to understand how severe the disease is or how aggressively we should fight it in that particular patient, even if there are large numbers who are coming into our OPDs or in our wards. The benefit of having the lockdown, which again was debatable, has been that it bought us some time. It bought us some time to get our medical supplies in order, to get ventilators working, to get ventilators designed. And that is helping us to a large extent today to being able to face up to the challenges that we have. And of course, we know that worldwide different companies, different universities have entered phase 3 clinical trials, even in China, Germany, and the UK, and we are hoping for the best. So there are positives that have come out till date. This is what I spoke about, going back to the basics. All of a sudden, we realized the importance of not just hand washing, but real hand washing. And this, in fact, has not only limited the initial outbreak of the COVID 19, but also reduced infections. So it's a good reminder that we need to go back to the basics that we actually took for granted. Again, if you look at, these are just some of the slides and information and posters that came out, and not really any of this was something new, but it was something that we had forgotten. We had become quite complacent, And this is a reminder that whatever basics we have learned right from the time of Lister, we have to maintain them, and that itself will keep us and keep the patient safe. This is just an example of a flowchart. Somebody was trying to do a study, and this is again what happened, that we just went rushing after the published literature, and today we have realized that just something which is published, it need not be fully trustworthy. We need to evaluate it properly. Again, you can see the huge the graph. Yes, this is not of the COVID patients. This is the number of publications that have literally hit the roof from February and March, and you can see that it is rising by the day. If you have a research publication on COVID, the chances that you will get it funded are very, very high today. But what is the quality of that research? One of the publications in Lancet, you can see the various figures that they have. But what I feel is more important, we need to read very carefully. We need to review the literature. We need to evaluate it using our own knowledge, using our own situation in the country. We need to assess the strength of the validity of whatever data has been put, discuss it with our colleagues, and only then should we implement it or change our style of treatment. Again, when we spoke about telehealth, this is a new initiative that the government of India has taken over. It's just been a few days, but you can see the large number of patients who are benefiting from this. And just today morning, I was sitting down with our principal, and I think it hardly took us 10-15 minutes. We needed a new um, prescription for his medication, and just in 10 or 15 minutes we were able to talk to a doctor, just tell him that we are otherwise fine, we just needed a new prescription. And I think this is again something good that we can take out of this situation that we find ourselves in. Coming to families and society, all of a sudden, me included, we realized the value of family time. Things which we had taken for granted, each one of us was busy, each one of us was doing our own thing, and despite being in the same household, we never really took out time for each other. Our relationships were renewed. Families actually made an effort to know, understand, and cooperate with each other. And this is, I think, something that all worldwide we can benefit. We can look out for positives, that we had got away from the rat race for some time. And if we can take this forward, it's so much better. We looked at online work, we looked at online meetings, even family events were celebrated online. I know of birthdays and anniversaries where people all came together on Zoom and were able to celebrate the occasion, but in a safe manner, and that showed a lot of maturity. And when we realized that suddenly this lockdown was there, we could not, what we took for granted, you could just walk across to someone's house, you could just drive across to your relations or to your parents, whatever it would be. The value of spending time with people who that matter, this was brought to the forefront as well. I'm sure all my friends who are there from Mangalore and Karnataka will recognize this game. I don't know how many of the youngsters would. And this was a game we learned again from my grandmother growing up. And this again has come where we spend time with the older people at home and were able to learn from them. This had actually become a rarity where you found the whole family sitting together, the three generations that we see here, being able to spend time without the TV, without mobiles, without a data connection, and yet having a good time with each other. Again, whichever the platform that you used, it was good for friends to connect, it was good for education, and all of a sudden we realized yes, there's an entire world available online, this time in a very positive manner. Coming to education and training, all of a sudden the established norms and practices were turned on their head. Even in medical colleges, our students were sent home, and we had to teach them, we had to reach out to them, we had to plan programs for them. And I'm glad to say that our students and even the faculty learn to cooperate. While we faculty were learning with baby steps online, learning how to function in a digital world, here the students came to the forefront and helped us out. They gave us suggestions, and all in all, I think it was mutually beneficial to each one. And today, we can't really think of a world without having a digital option or looking at online platforms. And all this has, I think, put in a new mindset. It's broken old habits that we took for granted, beyond just chalk and board, beyond the fact that we could just use PowerPoint, or you needed students to be sitting in the same room. And again, it was heartening to note that we had taken a little bit of feedback from the students, and a lot of them felt that when they were online, the connect with the teacher, they were able to connect with the matter or the subject being taught. And that, again, I think has helped us in the long run. So, what is the way ahead? We need to adopt, we need to adapt, as well as encourage these newer training paradigms. Let's keep it in mind. Let's use the technology with the strength that it can give us and take it forward in the days to come. So we have a huge range of various platforms. All of us have probably made these sort of sheets to try and evaluate what is good for us, what is cheaper. And I think that itself has been something good. This is the new student in his new classroom. You can see that with all the technology around him, he's still able to learn, and a lot of them do find it quite interesting. And yes, there are a few problems. I know the few teachers have been thrown out of their classes, literally, but they've learned, and even the students today enjoy this learning platform. The three most common words I think of 2020 would be: am I audible? Please mute yourselves, and can you see my screen? And yet, we have to remember that this is not something new. In fact, Zoom was launched on 21st of April, not 2020, but 2011. So that and a whole lot of other platforms have been around for a long time, but somehow we just ignored them, or we didn't think they would be as useful as they are today. And of course, that has launched a lot of competition. I come back to the words of being self sufficient and self reliant. And I think it's a good reminder for each and every one of us that to take this made in India policy far, far ahead. Environment, of course, we've seen the difference, we've seen the change. Most of us doctors were permitted to be out, so for us it was really a pleasure to drive on empty roads, and we could literally see the clear blue skies, and that again was a huge, huge benefit. And a lot of places we found that even wildlife had come out on the road, or would come out in the little bit of wooded spaces where we never thought them possible. And overall, nature was definitely recharged and revived. Not only that, even in our homes, because we suddenly felt that goods would not be available. And that reduced wastage. We reduced our use of plastic and started to look at ways and means by which we could recycle goods as well. So, a lot of bad habits changed, and I hope they continue. I don't know how many of you will recognize these photos, and they look straight out of a album or a visiting tourist diary. And yet, each and every one of these pictures that you see, ladies and gentlemen, is very much from India. Yes, it's our own country. During the lockdown, this is how clean and how bright and beautiful everything could look. So we can make a change if we want to. And let's remember this once we get back to normal. Again, a small video that I'd like to share of you. This is just the number of flamingos that visited Navi Mumbai. So let's watch it. So we can see that such a beautiful sight in a city that is bustling and teeming as Mumbai is certainly a rarity. And yet, this is what is possible if we just slow down. Even in other cities as well, you could see these animals which otherwise you had to possibly go and see in a zoo or in a restricted area. They were very much part of the landscape, and we could see them alive and well. Even the famous Yamuna River, which people had literally given up hope, all of a sudden had become so much cleaner. And this, again, is a reminder of how much damage we are doing to the environment and reminded us of the huge aspect of environmental ethics that we need to keep in mind. Coming to the economy, I know people feel that it's been damaged. There were so many issues regarding the lockdown. But remember, today there is a huge opportunity for the Indian economy. The international falling of prices of crude oil will definitely save us on foreign exchange. Yes, I know to a large extent the government has no choice but to increase the price of fuel, both petrol and diesel. The reason being that they need to have some income, so we need to understand their issues as well. But as the prices remain low, we'll see a long term benefit there as well. We are aware that there was a huge
I think we are. I think we have a power cut in Derek's place. We'll just wait till we get him back on. Dr. Derek? I think there's a power cut in Dr. Derek's place.
Till he comes back.
Yeah, well, let's take some questions that were put by the some of the questions that we've got from our from the participants. The one of the questions, I think it has been answered, but this is from Dr. Surit from what are the rights of citizens as against the ones volunteering to participate in vaccine trials? Question is, what are the rights of the citizens as against the ones volunteering to participate in vaccine trials? Rights of citizens versus people who participate or volunteer in the vaccine trials.
All the citizens have their rights. The volunteers are volunteering to take part in this. It's not they are making in all these trials. They volunteer, which is the requirement for the informed consent, that they volunteer knowing well that they're going to be infection is going to be introduced, and knowing, that's the question, isn't it? How well they know that that there can be fatalities. I think Derek's come back.
Yes, Dr. Derek, I think you had a power cut.
Yes, we had a power failure, so thank you.
Yes, so we are used to this. Go ahead, Dr. Derek.
Have a backup. Yeah, thank you. Yeah. Thank you. So I'll go back to my
present. Yeah, you'll have to load your PowerPoint again.
Yeah, I'm doing that.
Dr. Russell, you can mute your mute your microphone, please, because there's background noise. Yes, Dr. Derek, I think you had a power cut.
Yes, we had a power failure. Yeah, is the slide visible now, Dr. Mary?
Yes,
Okay,
yes.
great.
Go
Thank
ahead.
you. Yeah, so we suddenly learned that there was to be a huge emphasis on local products, on local manufacturing. The malls were closed, the Amazon could not deliver, and we suddenly rediscovered our old friends who had small shops in the locality, the little tailors, the little businessmen who we had lost and ignored them for many years. I think that led to a huge revival of these small businesses. And again, in future, I think we need to support them, because rather than talking about the Indian economy, we are the economy, and we need to support each and every one to try and grow and get back our lives together. We were able to survive without shopping, without restaurants, without partying, and life carried on, and I think it was quite rich. We know of even children who got together with their parents and tried out new dishes and made their life seem quite interesting despite the lockdown. And not only that, even other business models continued their jobs by getting their employees to work from home. So it just went to show us that life could carry on and life will carry on in future. Again, it's very depressing to look at these figures here, where you find the first and second quarters of 2020. But if you look at the predictions for the fourth quarter and much of 2021, you can see that we are going to come back, we are going to bounce back. And as the situation improves, I'm sure we'll improve on other fronts as well. Very proud to share this photograph with you. This is the team of the Indian Institute of Scientific Education and Research, ISER, from Pune, who, using indigenous and low cost materials, have developed a ventilator. It's already in the market, and these are some of the heartening things that we can actually look at, and very proud of each and every one of them. Again, another photograph of indigenously
Okay, I think Dr. Derek will come back. If it's okay with you, Dr. Russell, can we take one? There was a question, but I think this is regarding the vaccine. Dr. Russell? Yeah. The question is, what about any risk involved in participating as a volunteer for the vaccine trials? I think you have already addressed that. Is there any special insurance protection?
Entrance, is it?
Special insurance protection.
I don't know. This is depending on the country. The evidence we have from this that we have is from the United States. But if there was an insurance, that would be covered by the clinical trial, because we do have that even in normal clinical trials, which I have been running. The subjects were all covered by the sponsor. So
Okay.
I'm very sure that there'll be.
Okay.
Gerard might be able to say that. Is that right, Gerard? Certainly from the
Yeah.
multi-center trials, they were covered. That was a requirement by the committee, by the ethics committee, by the government, and so forth.
The question,
Yeah.
Professor Gerard, is there any special insurance protection for those who are participating in the vaccine trials?
Yeah, there is. This has nothing to do with corona or with this new type of study. So, in any clinical trial, there is a requirement that the sponsor who's going to organize the trial have to implement an insurance And this is good clinical practice. This is worldwide applicable, and this is one of the ethical requirements. So, in many countries around the globe, you won't get an ethical approval without submitting your insurance statement. So, this is definitely fine. If there is a need for this very special study types that were introduced by Dr. Russell this morning, if there is a need for something extra, then most probably this has to be provided as a kind of extra requirement by the ethical committee or the institutional review board who is going to approve the trial. Yeah, but the general one is applicable to any kind of medical research study. Yeah.
Okay, thank you very much. Dr. Derek, are you
Yes,
ready
yes,
to
yeah,
come back
I'm
on?
back. I'm back. Yes.
Okay.
So coming back to that, we had this indigenously produced ventilator again. It's very tiny. I believe it's just the size of a normal toaster that you would see at home. And we have so many alternatives, and these are again already in the market. So let's support these initiatives and try and ensure that we become more and more self reliant. Coming to the political fallout, because ultimately we need the support of the government and we need the support of the politicians. Yes, the anti China sentiment will definitely help the government to a large extent. I think it will also help our Indian economy if we become self reliant. We've seen that to a large extent, a lot of talks and speeches of narrow minded politics have reduced as well. And I'm glad the government has also come up with this whole idea of Atma Nirbhar Bharat, where it means self reliance and ensuring that we can grow and we can do things better on our own. So we need higher preparedness, and there's a need to be united, and we need to take all sections of the society into facing the real challenges for the future. So this is a study that was done recently. About 9,000 participants were polled, and we can see that more than 52% felt that Indian quality is still better. So let's support our local economy. I know sometimes the Chinese products are easily available and they're cheaper, but if we want to change our situation and we want to improve ourselves in the future, let us support Made in India. So there is a need to improve, there is a need to build on. There are still a lot of unethical practices by the entire healthcare profession. We've heard of doctors who themselves are being refused admission. We know of doctors who have literally given their life and then not been able to even get a decent burial or cremation. There have been numerous instances where medicines have either been black marketed or even the entire line of treatment. There is a question whether it is actually true or whether it has been simply pushed by a particular section of the pharmaceutical industry. So let's try and correct these wrongs because that is in the interest of society. Let's discipline ourselves and our society at large. If we are asked to wear masks, let's not look for a fine, as Dr. Russell told us, or look for somebody to go around, a policeman to come and remind us. But just wearing a mask, I think, is something simple, and each of us can unite to face the challenge. We need to share knowledge and technology across our country and across the world. Of course, there are questions: is it really ethical and is it really right to have so many different types of vaccines, all trying to reach the same end? But still, we can make a change. And if we respect each other's profession, like I said, all of a sudden we depended on the local milkman or we depended on the local trader, and they came through. They would actually come to the doorstep and deliver vegetables and other provisions for us. So let's not forget the contribution of each and every one, not just in the healthcare profession, but even other professions as well. So, can we build some proper future? What are the lessons that we can take from the pandemic? We need to remember our strong foundations, like I said, whether it's basic hand washing, whether it's respect for all aspects of the healthcare profession and other professions as well. During the pandemic, also, we had to do this SWOT analysis. We had to look at our strengths, our weaknesses, what were the opportunities that we could undertake, and what were the threats that were coming in future. We need to prepare for adversity. Okay, the next pandemic may not be immediately there, but we need to prepare our students, we need to prepare our hospitals, and society at large needs to be prepared for any adversity as and when it comes. I think we had become too complacent, we had become too comfortable in our own setup. Everything was hunky dory, everything was good, and that complacency was suddenly shaken to the very core right from December and January of this year. The way forward, of course, self reliance and self sufficiency as a country, even as a state, or even in our city, we need to ensure that we have alternatives and we're not really stuck in any way, whether it be healthcare treatment or whether it be keeping society at large. We need to think out of the box. We need to look at newer ways that we can face the challenges that are coming. And of course, innovation, it's already there. We who are there in the administrating levels or those who have funding to uh, distribute, let's respect that innovation and ensure that we can support that as well. So you can see that the entire Universal Declaration of Bioethics and Human Rights, every aspect of it has suddenly become important. And we need to remember all this, whether it is integrity, respect, following the rules and regulations, ensuring social justice, dignity for our patients, whether they are alive or even after they are no more, maintaining the confidentiality, competence, moral courage, ethical practices, the basic values, privacy, honesty, beneficence and harm, autonomy, all of them need to surround this complete healthcare that we have to undertake as a profession. And I thank you once again for a patient hearing. Best wishes on your journey. So let's continue to do whatever little bit we can. It doesn't matter whether you're a student today, which year you are in, or even if you're a senior faculty or an administrator. I'm sure we can all join hands together, surround this society, give them the support that they need, and I'm sure that there'll be a brighter future tomorrow. Thank you once again to Professor Satish Bhandari, the entire team at Shema and Nitte University, and of course, Dr. Russell and our own team of the Indian Bioethics Program. It's been wonderful sharing this and putting this together, and I'm sure the positivity will go ahead in the days to come. Thank you. Over to you,
Thank
Dr.
you. Thank you, Dr. Derek. You are so right when you said there are things that we have discovered during this lockdown. I even discovered a small shops just down the corner, which I've never seen in my life all these years, even though I've been here for 30 years. And the question of small businesses and encouraging I missed my cobbler a lot, so these are the things. Just before we wind up, there's a question in the chat box.
Yes.
The question is, how do we stay positive?
Yes. I think it's very simple because once we realize that just staying positive itself encourages more positivity. It's very easy to become negative. It's very easy to look at the wrong which is happening. To, in fact, that is one of the ways that media adds to the confusion, because unfortunately they only highlight the new cases, they only highlight the number of deaths, Whereas countrywide today, we find the number of people recovering, all the good that is being done is not really highlighted. So again, each one of us is responsible for this. Yes, at times it may amount to blowing our own trumpet, but even outside our hospital, why don't we put a huge board which tells us the number of patients who are recovering? Maybe the media won't pick it up, but even our students can click photos of that and make it viral. That they would love to do. So let the WhatsApp, let the social media, let the Instagram, whatever it is, be flooded with positive messages. And in fact, as this pandemic has grown and progressed, people also realized, and in fact, I've seen it personally, that the number of forwards actually went down. And to a large extent, I think even the government was controlling the media to some extent and not allowing them to just publish any and every news that was there in February and March. And I think that was quite responsible to lower the overall panic, the overall sense of crisis that was there, because people were fighting the disease. It wasn't that the government or the administrators were sitting quiet. And the minute that happened, the minute I personally stopped reading all the WhatsApp forwards that would come, or keep watching the videos, which were actually, some of them were not really true, of patients or doctors suffering, my own panic levels came down. So, if we look at the positives, if we start evaluating a forward before sending it to others, is that information correct or not? Is it worth forwarding or not? And will it benefit someone? So, even if it may be correct, even if it is going to induce a panic in others, I think if we stop forwarding such messages, we can forward it maybe to an administrator, we can forward it to someone who can take corrective measures. But just forwarding it to my rest of the society or forwarding it to my fellow students may be actually counterproductive.
Thank you,
So
Dr.
if we
Derek.
keep these few things in mind, I think
Yeah,
everything will
thank you.
suddenly
Thank
improve.
you, Dr. Derek. Your suggestion, even to put what is positive about recovery rates, is really a marvelous and a good idea, because our medical students, a lot of them are scared, they're worried, they're depressed. So we need to create this atmosphere of positivity, not only in the medical school, but also around it. So thank you very much.
Yeah,
And
when we talk of students being infected, let's also remind them how many have recovered.
yes, Professor
In our own
Bandari would,
institution, we've
yes,
had interns and PG residents who unfortunately were tested positive, but I'm glad to inform you that all of them are well on the road to recovery. So let's make
yeah,
that information also get out there, and
okay.
people, the panic will, of course, reduce.
Yeah, Professor Bandari, you want to say
Yeah.
something?
Before we conclude this wonderful webinar, and Dr. Suraj will be proposing the vote of thanks officially, uh, I should congratulate the team. They have done wonderful discussion here, and all of us have been benefited by this webinar. And in a lighter vein, I think I should compliment Professor Gerard for this wonderful presentation, and also his country for successfully containing COVID-19 pandemic. Uh, Probably there's a connection between the gender of the premier or the chancellor and the country which has controlled the pandemic in the world. I was told that most of the countries with the
Yes,
female premier, it has COVID has
done
been
well.
well contained. I think that may be one of the rare
Yes,
connections between these two aspects. Once again, I congratulate my friend Russell. I think we'll be missing the Mangalore fish curry and your company here. I think we're looking for that. I think year 2021 it will happen. And again, uh,
Very
Thierry
well.
and Dr. Daryl. And I should congratulate once again the whole team. Thank you very much for accepting our invitation and participating in this webinar. Over
thank you.
to Suraj.
Thank you, Satish and Gibran.
Yeah. On behalf of Nitte DU and the entire University Bioethics Steering Committee team, and on my own behalf, let me extend a very hearty vote of thanks to our speakers. Our chat box is filled with appreciation for the speakers. Now, I must mention a deep sense of appreciation for Professor Dr. Russell for his explanation of human challenge studies for the COVID-19 vaccine and the ethical aspects that arise out of it. We may all agree that Professor Dr. Russell is the driving force of many bioethics units in India, and his work in the field of bioethics is really commendable and worth emulating. And further, we are grateful to Professor Dr. Fort-Wingle for showing us what are the ethical challenges that are associated with our response to COVID, and Professor Colonel Derek D'Souza for giving an excellent coverage to the idea of staying positive through this adversity, sir. That was very much needed. Thank you, sir. And I'll also wish to express my gratitude to Professor Dr. Mary Matthew for moderating this session, ma'am. Many thanks for your time and contribution for this program. And ma'am, you have been very impressive with your moderating skills in all the bioethics webinars that we have been attending of late. And finally, I would like to take this opportunity to place on record a hearty thanks to Sadhana Deshmukh and her team from the Staff Development Center for this perfect logistic support and guidance that you guys have extended to us. Thank you. And